Healthcare organizations today must navigate many complex challenges, including access to care, crisis levels of provider burnout, government mandates, and new payment models. In order to meet these growing demands, healthcare leaders are looking to new management models to improve their organizational culture and address the efficiency, quality, and safety of care delivered to patients.
There are many mindsets that we really feel need to change when we're dealing in healthcare, and a lot of that really starts with what does it mean to be patient first? And the other big area is focus on quality. What does it mean to create great quality care, safer care, and really beginning to understand that standards are needed and standard work is needed to create more safe and reliable healthcare systems.
Go see, ask why, show respect. When healthcare leaders go to the place where the frontline staff are doing the work, they are better positioned to engage those within the organization to come up with the improvements and solutions that will enable them to deliver better, safer, patient-centered care.
Flow basically means that we are taking the patient's demand for services and meeting it right when they ask for it. It means that we don't have any delays. We take a look at the waste in our processes and try to remove them so we're available for our patients. So this takes a whole team to make it happen so that whatever the patient needs, we're able to get done right then and there when they ask for it.
By focusing on processes and flow in the clinic, what we see is that we're better able to utilize the resources in the clinic and better to align the tasks that we're doing as individuals to our skill set, and as a result provide a better experience for the patient along the way.
Working in flow entails two main things. First is working side by side with your provider, and secondly, not batching your work. This means you can anticipate things, what your provider needs, what the patient needs, and so you're able to decrease wait times. And not batching allows you to send those referrals as they're ordered by the provider, make phone calls, relay test results as soon as they're online, and ensuring that it doesn't pile up for the end of the day.
Using a proven management method, Virginia Mason Institute coaches other organizations to improve their processes and workflows in ambulatory and acute settings, as well as in the design of healthcare spaces to enable staff to complete more value-added tasks in less time by applying the concepts of flow to their unique setting.
Since I started here at Virginia Mason as a primary care doctor, I've really seen the benefits of working in flow. This is over 10 years in the making in terms of creating these flow stations, creating standard processes for patients to come to our clinic or call in or send a message through the internet. And we've built a lot of standards in place, which means that all the team members are doing things the way it's supposed to be done, the right care at the right time, every single time. So that actually frees us clinicians up to really delve into the patient's particular problem and offer our expertise in diagnosing and managing their issues.
It's possible to do things differently. By introducing the concept of flow to the healthcare setting, providers can optimize their processes so that every task is directly tied to delivering right care to each patient at exactly the right moment. Administrative tasks and paperwork volume can be reduced, and healthcare professionals can enjoy a greater work-life balance and job satisfaction.
Working in flow does help to improve team collaboration and communication on a daily basis. So one thing we do here at University Village is a huddle between the provider and the medical assistant, and oftentimes the nurse and clinical pharmacist as well. And what this does is it helps to ensure that we're looking ahead, making sure that if there are any foreseeable flow busters, we're able to adequately prepare for them.
Working in flow creates a greater balance of skill-task alignment across team members and produces a more coordinated, collaborative, and quicker approach to delivering care, and as a result also helps to lower associated labor costs.
Healthcare is always changing, so there's new clinical practices, there's new operational practices that are considered best in class, and so we always have to be improving how we're delivering care. So when we're working in flow, that means that patients get the care they need when they need it, where they want it, but also the team is able to have fulfilled careers and also get to go home on time because we're getting our work done at the end of the day.
Patients themselves have told me about how us working in flow benefits them, and it's so great to see gratification from patients themselves about what we do here.
I think the great thing about doing this work and working with organizations that are trying to improve flow is what they get back. And the real joy and that aha moment that life can be different. The way it's being done isn't the way it always has to be done. And for patients, it's walking into an experience that is not what they expect in healthcare. They get to put down the book that they brought to read because the day's going to flow so much better for them than they've ever seen before.
To learn more, visit us online.